Bienvenue à toutes celles et à tous ceux qui nous rejoignent dans cette nouvelle conférence de l'Observatoire de la e-santé dans les pays de Sud. Depuis ce matin, nous nous interrogeons sur les manières d'évaluer les projets de e-santé, comment capitaliser sur l'innovation, ne pas reproduire les mêmes erreurs, apprendre des autres, trouver les facteurs de succès pour un projet, les facteurs qui vont permettre son passage à l'échelle. Et on va à présent poursuivre ces réflexions, si vous voulez bien, nous attardons sur les facteurs qui font qu'un projet soit pérenne, parce que ce n'est pas tout de lancer un projet en e-santé, mais comment faire pour qu'il dure véritablement dans le temps, comment faire pour qu'il ne disparaisse pas si ses promoteurs s'en vont ou s'ils n'arrivent pas à passer le relais à d'autres acteurs. Et pour répondre à ces questions, j'ai le plaisir et l'honneur d'avoir autour de cette table aujourd'hui Aristide Afèignindou Gnassingbe. Vous êtes alors coordinateur national pour la santé digitale au Togo, c'est-à-dire votre niveau de connaissance du sujet, et en plus, ou avant, j'ai envie de dire, ministre conseiller à la mission permanente du Togo auprès des Nations Unies. Merci beaucoup d'être des nôtres aujourd'hui dans cette journée de la Fondation Pierre Fabre, Observatoire de la santé dans les pays du Sud. Sébastien Kusznier, directeur d'IT for Life à Dakar,
we also have Sébastien Kusznier, manager of IT for
aux ONG,
Life,
aux associations, aux entreprises pour les aider dans leur déploiement de numérique. Et puis en duplex avec nous depuis Dakar au Bangladesh, si tout se passe bien, Mridul Chowdhury, qui est directeur de mPower Social Enterprises, qui gère notamment Traumalink au Bangladesh, dont on a parlé ce matin. Bonjour Mridul, je ne sais pas si vous nous entendez correctement. Quelle heure est-il aujourd'hui à Dakar, si vous êtes bien là?
Yes, I can hear you fine. Right now it's 6:30.
Écoutez, merci beaucoup infiniment d'être avec nous dans cette conférence. Pour des raisons de Covid, il faut le dire, malheureusement, vous n'avez pas pu venir jusqu'ici et assister en présentiel à Toulouse. Mais heureusement, la technique, depuis ce matin, nous fait des miracles. Deux autres invités en duplex avec nous cet après-midi, le docteur Sharma, qui est en Inde. Merci Mridul. Oui, je disais le docteur Sharma, qu'on va découvrir également à l'image, qui est directeur de l'autorité nationale de santé en Inde. Merci infiniment d'être des nôtres aujourd'hui, docteur, depuis New Delhi, où vous êtes en direct. Vous avez notamment beaucoup travaillé sur la digitalisation des outils et processus de santé de manière générale en Inde. Et donc votre éclairage sera précieux tout au long de cette table ronde. Enfin, à l'autre bout du monde, voyez, pas un continent, un autre, cette fois-ci on part aux États-Unis, à Washington, rejoindre Jean-Philbert Nsengimana. Bonjour, si vous entendez correctement Jean-Philbert Nsengimana. Vous êtes originaire du Rwanda, parcourez la planète entière, vous êtes à Washington aujourd'hui. Au Rwanda, vous avez été ministre de la Jeunesse et des TIC, et vous avez été également directeur général de la fondation, cette fois-ci plus globale, qui s'appelle Project Fondation. C'est une fondation qui travaille à l'amélioration de la vie des citoyens du monde et à leur lien avec leurs données personnelles. Et vous nous expliquerez notamment comment cette fondation a travaillé avec certains pays sur les passes sanitaires individuelles durant la pandémie de Covid et au-delà de ce rôle, vous êtes aujourd'hui consultant indépendant. Je me tourne tout d'abord peut-être vers Sébastien Kusznier. Sébastien, un petit mot peut-être en premier lieu sur la société que vous avez créée, IT for Life.
Could you tell us more about IT for Life? Because this is also going to help us understand better what we're talking about when we speak of social challenges. Well, to start with, I would like to thank the Pierre Fabre Foundation for organizing this meeting, which I think is very appropriate. And IT for Life, what we want to do is to have sustainable perennial projects, especially bringing together skills and people who have these technical skills, so as to support some of our organizations which need this support. Now, so you have been working with NGOs, and you've noticed that they don't always have the tools they need. They don't always have someone who can help them, for instance, for the design or for the technologies. Answer: yes, this is true. Fair enough. But today we have very many different jobs, if I can say so. 10 years ago, you needed someone to manage the infrastructures and the different operational systems. Today, we need people who's going to do the evaluation, other people in charge of collecting data, other people in charge of security, technology, and data science. So you see, all this is new. It means many different profiles. We don't find so easily those skills. It's very costly, and therefore we're trying to work with private companies, but it's not so easy to find all these people, you know, because they're very often willing to work with private companies, and even though they come and work with us, they don't stay long. So we have to try to find a stable team. And this is why we're going to be speaking of a paradox, says Leonard, because since we started this morning, we know that the projects today are becoming all digital projects. We've had a real ramp-up of digitalization with very many investments and funding of e-health. But this means that we need skills, profiles that you can't find so easily, that you have to go and look for outside, and which are costly too. And there is a new culture, a new digital culture that you have to try to acquire. And it's not always the case for NGOs. Yes, I agree with you. The private companies have what we call consultants or other companies supporting them. And they're also trying to train the people they have in technologies, and this to bring together all the skills they need. Now, what you've said is very interesting, but challenging too, because you've been trying to list all the skills that we need. You need people for each one of the skills, of course, in all these communication systems. And in the NGOs, I think people are not always so aware of how technical this is, and sometimes they want free software, simple softwares. What do you think? Yes, answer. I think that there's another layer of complexity because we are in a very fast evolving context. So that means that today we are more demanding in some fields. We weren't so demanding a few years ago, and today we need more experts, people who have other expectations too, and at all levels. So either for recruitment, either for the salary. So you have to be able to keep up with all these demands. Another question. Now, how do the donors or the funders react when they're confronted to this increasing complexity of e-health? Are they imposing specific specifications or not, or are they aware of the complexity? Answer. We have two levels. I think that there is the Anglo-Saxon environment world, I think, where people really know that they have to invest, and in our French-speaking countries, and in France, where we have to explain to the organizations that they have to start evaluating, assessing, because we have numbers, but we don't always have the funds. And donors and funders who ask for the evaluation don't always provide these NGOs with the money they need, because they don't stick to or match with the profile these donors are expecting. So that's a real issue, you know. No, another question. So there are no norms which are imposed? Answer, no norms, and I would say that we need more norms, especially when it comes to funding. I agree. And I think that we have today professions which have nothing to do with what we need. Now, Mr. Minister, I would like to know if you share this view, that is to say, we have complex professions, jobs, and sometimes it means more organization. It's not always easy for some of our NGOs or associations. Answer. Well, thank you very much. I would like to start by expressing my gratitude to the organizers, because it's a great honor for me to be here with you in the e-health conference and see you here all, because it's really challenging. So thank you. And I think that, so as to answer, we have the same issues in Togo, where you have very many associations, NGOs trying to develop skills in specific fields. And this is why we started establishing a synergy. We wanted to create a synergy, coordination, because people want to make more achievements, but we don't have the skills for that sometimes. So this is why we try to bring together all these skills, to have a pool of people and also train people, because I think training is really essential, because we're speaking of an innovative field, and therefore the experience we've had up to now clearly shows that when we started with the telemedicine network in Africa, has not always been easy. I think that some people in the field have not always complied with what we tried to do, and therefore when we started with the authorities, the governments were not convinced, so we have to start convincing the government, because they were not aware of the importance of having tools and technologies, and progressively this has been changing. The authorities, government have understood more clearly that we have to get back to the essentials, that is to say the tools, but I'll go into the details when we speak about this. Now, if we look into what is going on, everybody is speaking of telemedicine, of e-health, but it's communication. It's more centered on communication and not so much on skills. So we have been asking for the support of international consultants who are still working with you. We have very many organizations and associations in our country which are trying to develop their own skills, because they know that this is a new opportunity. They can't miss this opportunity. But it's not only the fact that communication. Now, do you agree with what has been said this morning by Florence Perkins and also what Sébastien has told us? That is to say that there is a breach between the English-speaking African countries and the French-speaking countries of Africa, maybe because the GAFA and the players, the major players of technologies are more present in the English-speaking countries, but in French-speaking countries in Africa, it's not the case. Okay, well, I can tell you that this is an issue, but it's not only in the field of e-health. And I'm in Geneva. I've been in Geneva for more than 8 years, and I've been a doctor, a physician in my own country. And when we get together, when we meet, we really notice that there is a gap, there is a breach between the English-speaking and the French-speaking countries. Even when they want to take the floor, it's difficult for them. So this is why we have to ask ourselves, what's going on here? And there are associations which have started to get organized and who have started to produce documents and share this with English-speaking countries. And when they come to the meetings, the questions they pose are very appropriate when it concerns the implementation of the programs. But having said this, these meetings don't take place very often to start with, and when we have to coordinate things, we can't, because we have very diversified views and approaches, so it's not easy, and therefore many issues crop up. Is it due to the language barrier, or is it because we have different cultures, you see? Well, I would like to ask someone else in another country who is an English-speaking, non-English-speaking country, in India, Dr. Sharma. You are in charge of the National Health Authority Government of India. It's a great pleasure for us to have you here. You're in New Delhi. Dr. Sharma, I would like to ask you, because you've been working for a long time now in the e-health in India, do you agree with what we've just said at the beginning of this roundtable session? That is to say that digitalization requires many specialized skills, which is not always the case in many companies.
Well, first of all, thank you very much for inviting me to this conference. It's really a privilege and pleasure to be here with you. And I've been hearing with interest the views of the panelists here. I think there is certainly an issue on the expertise available in various domains. But let me say that it's not really so much a question of expertise, but it's also a question of architecture. How do you architect the programs, or how do you bring together all the pieces of digital health is an extremely important issue. We have to think of this whole subject in a cohesive and comprehensive manner. For example, in India, we have started the National Digital Health Mission, which essentially means that we are making building blocks of an interoperable, structure, whereby the patient's health records are being maintained we are creating a health identity for each person, because we already have a digital identity called Aadhaar in India, 1.3 billion people. So that's what we are doing, and we are creating registries, health professionals registry, health facilities registry, drug registry. And then we are having a situation where a person will be able to share his or her health record with doctor, with other institutions, with the insurers, for example. So I think, and of course, again, we are having an interoperable teleconsultation system, which means that you don't have both the doctor and patient do not have to be on the same application. They can be on different application. So in my view, what is important is actually to create an architecture which is interoperable, which is scalable, which actually takes into account the diversity, which is inclusive, which actually doesn't differentiate between the people who are digitally literate and people who are not digitally so literate. And that, I think, is what is required. And we in India, having built a number of large systems, like, for example, in the COVID period, we built what is called CoWIN, which is essentially a software or a platform which recorded the vaccinations of our people. And on this platform, we have recorded as much as 1.98 billion vaccination doses, and each dose is recorded. Each person can download his or her certificate of vaccination, and each person is basically reminded as to when his next dose is due. And we have already vaccinated about 80% of our population, which is, again, you will agree, is very large population of 1.3 billion people. So that, I think, we need to create an architecture, and having clarity in that architecture, I think you can always find people with requisite expertise and skills in the market. I agree with you that the some of these skills are difficult to find, but then once you have this architecture, it is possible to basically scale up your programs. So I would advise, my advice will be that please ensure that you create something which is open source based, which is based on open standards, which is based on open APIs, and which actually is as inclusive, and a system which is able to capture the diversity of every country. In India, you have 26 languages, in a country, and you have hundreds of these dialects, and we are able to sort of cater to everybody. That itself is a big challenge, but I think that challenge can be met with open systems.
Docteur, lorsque aujourd'hui des ONG ou des entreprises viennent vous présenter un projet, ou présentent officiellement un projet aux autorités ou au gouvernement, quels sont les 4 ou 5 maximum points clés que vous allez regarder et vous dire d'un point de vue gouvernemental, OK, là je pense que ce projet va réussir.
And say that, well, that project may be a success if we meet all these requirements?
Well, one is that when you talk of digital health or e-health, it is not that the companies are going to submit projects. It is the government or it is the public systems who are going to prescribe what that project will consist of. And the companies are given what is called a clear mandate, a clear task, a clear job, which they have to perform. So that's number one. Number two, what we have to see is that the companies deploy appropriate resources to fulfill those tasks. It is not as if, they are coming and telling us what we have to do. We are going and telling them, this is what I require. And therefore, I also agree that there is an internal capacity which has to be there in the government systems, which means that we also have to know as to what we want. Otherwise, what will happen is that these companies will come and they will, drive the whole agenda rather than we driving the agenda. So while we can outsource many things, we cannot outsource thinking, the strategy. And that, I think, must remain within our control. And then after we have clearly defined what we want, thereafter the companies have to deploy resources with the appropriate skill sets, and then they have to do a particular job in a particular time, which means it has to be an outcome-based payment, which means that when you do this job, I'll pay you this much amount. When you do another job, I'll pay you this much amount. So that way, you are tying up the payments to the companies on the basis of what they perform and how they perform. And I think that's the right way to go about contracting the jobs to various companies.
Effectivement, comme vous le dites, avoir des objectifs,
As you have
des
very
objectifs communs
clearly
et
said, we
partagés
need common
des
and
deux côtés pour
shared
pouvoir avancer.
goals.
Toute dernière question,
And a very
Dr
last
Sharma,
question,
parce que je sais
Dr.
que votre
Sharma,
emploi du
because I
temps
know that you
est assez strict en ce
are
moment.
very busy, and thank
Sébastien
you for
Kusznier, tout à
answering.
l'heure, nous
Sébastien
disait qu'il y a
Kusznier
une
just
difficulté
said that
de la
it
part
was
des
sometimes
ONG
difficult for
parfois à avoir de
NGOs
l'expertise en interne.
to have
Il faut
to
rechercher ailleurs
find
parce
the
qu'ils n'ont
appropriate
pas forcément
expertise.
la
They don't always
connaissance
have
très
it
fine du
themselves
design
because they don't
architectural
always know
aujourd'hui des systèmes
enough about the
d'information.
design and the
Qu'en
architecture of
est-il des autorités
information
publiques
systems. Now, what
dans des
about the
gouvernements?
public
Est-ce
sectors?
que
What
vous
about the
aussi,
governments?
vous avez
Do
cette
you
expertise?
think
Est-ce
that
que vous êtes en
this
train de
expertise can
changer
be
l'expertise
found
ou d'acquérir
at
cette expertise?
in the public
Est-ce que
services? Do you
vous
think you're
changez votre
acquiring
manière
this expertise?
d'examiner des
Do you
dossiers
think that this
digitaux
changed your
depuis
approach when
7,
it
8,
comes
10
to
ans?
examining some of these e-files?
Is this question for me?
Oui, s'il vous plaît.
Yes, the question is for you, Dr.
Puisque
Sharma.
vous représentez ici une institution, voilà, une institution.
I hope you
Il y a pas de
understood the
souci.
question.
Une institution publique,
Okay,
justement,
because
c'est
you're here, you're
intéressant de
representing a
savoir
public
si les
authority. So we
institutions
wanted to
publiques
know
se
if the public
structurent, elles
authorities
aussi,
are really
pour
getting
changer de
organized today so
culture
as to
et changer
change
de
their own
compétences
culture
en
and
la
be able to
matière.
have new skills. Okay? Question is for you.
Yes, I think what is required is, we have two kinds of systems in the public authority. One is the typical civil servants who may not be really experts in technology, but then we also hire people from the market and basically make them a part of our system and structure, which means then they work for us, they work like us, and they are the ones who are basically becoming an interface between the civil servants and the companies to whom we, give the work. I also want to share with you very, very important information that whatever system India has built, they are all very, very open systems. So, for example, those systems and architecture are available for free to any country. They are what we call digital public goods. We have made them as a digital public infrastructure. For example, the vaccination platform, which we have created called CoWIN, is available in open source, free of cost to any country which wants to use it. Our Prime Minister, actually, we had a conclave last year in July, and large number of countries, even from Africa and Europe, they participated. And there we said that we will make this whole project open source and also offer it as a gift to any country who wants to deploy that project. And because our projects are in open source, they don't cost anything. They just have to be configured and deployed. And I think that's the way to go about it. We believe in creating digital public goods, which means that anybody can use them and any country can use them, and they are open systems. But to the specific part of the question, I would say yes, there is a need for internal capacity building of the government, because we have learned the hard way that you cannot leave everything to the consultants. You cannot leave everything to the companies, private companies. They will not really you will not be able to control them, so to say. And therefore, you need to hire people from the market. And I agree that it's a difficult market at this point in time, especially after COVID. People, it's difficult to find expertise. But I think you need to hire and you need to make them a part of the public system, and so that they are able to provide you and actually supplement our technical knowledge.
Merci beaucoup, Dr Sharma, de ces explications à la fois précises et pragmatiques aussi sur la manière dont vous organisez pour vous qui dirigez l'Autorité nationale de santé en Inde. Merci infiniment d'avoir été présent dans cette conférence. Merci à vous, namasté, et je vous libère puisque je sais que vous avez un emploi du temps qui est très strict. Merci beaucoup d'avoir été présent sur cette conférence. On peut l'applaudir, le Dr Sharma. Sébastien, effectivement, cette question se pose. Vous disiez tout à l'heure, et les ONG, et c'est normal, ne peuvent pas toutes avoir des experts aujourd'hui informatiques dans tous les langages qui existent et tous les designs possibles. Est-ce que du côté des gouvernements, des autorités publiques, vous avez aussi parfois cette difficulté à leur expliquer quelque chose qui n'est pas forcément de leur culture du quotidien non plus lorsqu'un projet est présenté?
Ouais, d'ailleurs, on en parlait ce matin ensemble. Et c'est vrai aussi pour nous. Là, on parle tout le temps du Sud. C'est vrai pour nous. Et si on parle de la France, pour que ce soit plus intelligible pour beaucoup, aujourd'hui, on a cessé de rivaliser. C'est-à-dire que sur cette question des data centers, là, la France vient de faire un partenariat avec un privé pour dire installez vos data centers parce qu'on n'est pas en capacité de faire la même chose que vous. Et du coup, ça, on doit aussi le comprendre, l'accepter ou pas. Mais si on l'accepte pas, ça veut dire qu'on va devoir revoir nos souhaits à la baisse, notamment sur tout ce qui est machine learning, intelligence artificielle, etc.
Ça veut dire, si j'entends bien votre propos, que là, on pouvait encore se permettre, allez, mettons, il y a 15 ans, 20 ans, d'avoir, pourquoi pas, plusieurs ONG sur le même type de projet, développer des outils similaires, chacune de leur côté, voire avoir de la concurrence, c'est arrivé entre ONG. Dans le monde globalisé, complexe dans lequel on vit et où chaque technique de recherche est de plus en plus précise, on ne peut plus se permettre ça.
Si, on peut toujours se le permettre parce qu'on a le droit à l'erreur et que c'est bien et que c'est important aussi. Par contre, on doit se parler. Et donc, ce type d'événement est hyper important parce qu'on doit se mettre d'accord aussi. Donc, on parle d'open source, mais l'open source n'est pas du gratuit. Open source doesn't always mean that it's free of charge. We need to agree on products, on the right products to harvest data, for example. There are some tools that work very well, but they're very expensive. People working in this company are expensive. Spotify, for example, want to même si ces outils-là sont passés aujourd'hui à l'échelle, ils ne sont pas rentables parce qu'il n'y a pas de... Qui va pouvoir financer ça sur la longueur, c'est extrêmement difficile à faire.
On est en duplex tout à l'heure avec New Delhi. Je vous propose de partir à l'autre bout du monde, vers Washington, rejoindre Jean-Philbert Nsengimana. Sur le constat, Jean-Philbert Nsengimana, que dresse Sébastien Kusznier sur cette difficulté d'avoir des spécialistes aujourd'hui des systèmes d'information au sein des ONG, peut-être la nécessité demain d'externaliser ces fonctions. Quel est votre sentiment?
Yeah, absolutely. I think in many countries in Africa, the need for more expertise is clear. And in my experience, the expertise, people tend to look at the expertise just for the technical level, people who can develop systems, who can maintain, set up infrastructure. But there is, I think, the skill set that is most missing, in my view, is the skill set that bridges the needs between the policy people and the technical people. I think my colleague Sébastien talked about the difficulty to convince politicians, high-level decision makers on the importance of e-health or some of the projects in e-health. And I think that difficulty is a result in many instances of the fact that the people trying to convince don't speak the language of the people they are convincing. So there is a language that needs to develop between technology and health, and the people who can speak that language and translate between the two fields are very few. So when we talk about the lack of skills, I would actually start at the very top to ask the question, do we have enough people who understand both health and technology so that they can translate the opportunities of technology to the public health people, and the people in the public health can ask the right question to the technology people and have a conversation which will result in the right decisions to be made to push e-health forward. But at the immediate lower... Go ahead.
Non, excusez-moi, je voulais rebondir sur ce que vous disiez qui est assez
Yes, I'm sorry. I just wanted to pick up on what you just said because it's extremely interesting. Indeed, it's difficult for a top manager or a decision maker. Sometimes it's difficult for them to understand extremely technical projects. And sometimes it's pretty cumbersome when you're a health minister, irrespective of a country, be it in the north or in the south. You're not supposed to know what is DHIS2 or any Java code. So for you, how can you transform that in a criteria for success? Should we raise awareness in our top decision makers, or should we recruit the right persons? So for example, at the Minister of Health or the Minister of Telecommunication, should you recruit the people that are able to translate? What are the solutions?
Yeah, those people exist, but they are very few, and I don't think there is enough to go by in each country, in each department that need those people. So you have the Minister of Health, you have the National Public Health Institute, you have these major health providers who also need digital transformation. So the demand for those kind of people is very high, and I think what needs to be done is to really invest decisively in training that kind of profile. I would say that I've seen in many places, including here where I am in the US, there is a very famous fellowship called Health Informatics Fellowship that is run by the CDC. The Africa CDC is going to embark on a similar type of training. I've seen public health schools in many countries starting public health informatics to try and train those people. And basically, I think we also need to recognize that somebody talked about the culture. I think it's you. You talked about the culture that comes with digitalization. And we need to also recognize that there is a nuance and difference in culture between the tech and the public health. Public health is a very vertical type of culture where the senior doctor, the senior consultant is almost like a general in the army. So it's a very hierarchical, and public health people tend always to see where they fit. Technology is flat. You know, it doesn't matter. You can go to any large multinational company, you'll find the CEO sitting on the same floor, open space with the people. So they promote a sort of an egalitarian kind of culture, so there is even a clash of culture between the two sectors. So what I have seen working well is actually to take public health people and train them on technology than taking technology people and train them in public health in order to bridge that gap. Both works. You can get very talented tech guys who can embrace public health, but gaining the respect of public health when you are not a doctor, you are not seen as somebody of their world, and gaining their respect and gain their attention, in my view, has been hard. But there is enough people in the public health domain who love technology, who love analytics, who love data, and who would love to do more with technology. I think those are the people that we need to go and find and really train them, equip them with the jargons and languages and understanding of technology so that they can import that into the public health. But I'm not suggesting we should also stop at looking at people with a primary background in technology who also like public health, because so far many of the applications and the platforms that we have today in existence in e-health actually were developed primarily with people who come from tech background and who are innovating to transform health. But no wonder why there are also a huge graveyard of e-health applications.
On voit bien avec vous effectivement que
we see very well
from
what you say that these solutions are not only technical, these requires change in culture, in mindset, in the way we work on both sides. Now, a last question,
vous avez vécu une expérience intéressante
you had a very interesting experience sur un projet
pour créer des passes sanitaires sécurisés, reconnus pour les personnes vaccinées contre
health pass to recognize people
en
vaccinated against
Afrique,
COVID crisis, especially COVID disease, especially in Africa, so safe, a lot safer and free of charge, if I'm not mistaken.
De manière très
so you were part of that project.
Comment
Now,
les choses
very
se sont-elles
concretely,
passées avec
how
les
did this
gouvernements
project unfold? How did you collaborate with African government? What were the key success factors of that collective project? So how did you go about this?
Okay, first of all, I don't think there has been any successful health pass in Africa so far. There are so many projects. The smart health card, which we try to use as a health pass, is one of them. But I have seen in different regions in East Africa having the EAC pass, in certain health passes in West Africa, Southern Africa. I've seen EUDCC, for example, trying to make inroads. I'm aware of the conversations that happen between certain African countries and India on adopting their health pass. I would say all those projects made progress. In fact, Africa CDC and the African Union had its own trusted travel pass as well. So I wouldn't really honestly say that there has been a huge success in any of this, because none of them really was able to be rolled out at scale. So, but I would say that the ones that I know that have made progress are the ones that, first of all, addressed a need of the countries at the moment of the height of the crisis. All these solutions tended to lag a little bit behind the waves of COVID. So, for example, there are so many good passes that are ready now, but the COVID wave is gone, and the need has disappeared. There was a time where countries were really afraid of being contaminated by the international travelers, but at a certain point, countries realized that they have COVID at home, so the pain they were feeling due to the fact that borders are closed, international trade has stopped, tourism has stopped, that pain became a lot bigger than trying to stop one guy who's got COVID and crossing the borders when they know they already have COVID in their own countries. So that need of a COVID pass or a health pass sort of died progressively, but countries had made commitments and so on. And I would say that the most important thing today, as I have seen, is to wonder all the efforts that were made in designing and deploying those pass sanitaire, COVID pass or health passes. How can we ensure that those efforts and investments don't go to waste? And here comes, I think, something that Dr. Sharma talked about, which is standard. Or norms, I think you also talked about them. If those passes were designed according to certain open norms, open standards, using open software, then all the efforts that were invested in developing those passes are not going to go to waste. And as far as the Commons project is concerned, we introduced the smart health cards in Africa, in East Africa, especially Rwanda, Kenya, and we worked with the East African community, and in Senegal. Senegal has finished the development and has started a limited deployment, and they are about to go wide in deployment of the smart health cards, which is an open standard, open software. But the most important thing is it's just not for COVID. So if you do something that can only be applied to COVID, of course that thing will be obsolete when COVID is no longer a priority. I'm not saying COVID is going anywhere, but from the policymakers' perspective, it will stop to become a huge priority, and those investments will go to it. And transforming, if just allow me to finish, the fact that the idea of using a COVID pass to just carry health information, I think that is the most powerful idea that can be applied across the entire health service spectrum.
Ouais, je voudrais rebondir justement sur ce que vous dites et poser la même question. Il y a plein de propos, plein d'idées qui ont été mises là sur la table par Jean-Philbert Nsengimana, Sébastien. La première, c'est celle des standards. On revient toujours sur la poule et l'œuf. Comment je peux faire un projet pérenne, sachant que je n'ai pas forcément de standard non plus, de cahier des charges qui m'est imposé, mais comment aider aussi des gouvernements ou des institutions internationales à monter un cahier des charges, sachant qu'ils n'ont pas toujours les compétences pour aller le faire. Quel est votre point de vue sur cette question?
Déjà que les standards, ils existent. Il y a beaucoup de littérature là-dessus. L'open source, c'est pas nouveau. C'est pas
papers or literature, open source standards are here, have been here for a while. A number of players have worked on Digital Square, for example.
Ça veut dire qu'on ne l'impose pas, le cadre, alors?
So you mean we don't impose this? Well, we do not impose this upon ourselves, because we need to understand those standards. GDPR is, for example, a standard which exists. Now we need to comply with it, accept it. This is not a given. This poses a number of constraints to the project managers, because you need to comply
la
with a
RGPD,
number
le
of
cadre
rules.
existe,
GDPR, yes, that's right.
il
The
est
framework
obligatoire,
exists,
il est
it's defined,
sanctionné
it's
s'il n'est pas
compulsory,
respecté.
and you may have
Est-ce que ça veut
sanctions
dire
if you
qu'en
do not
matière de santé
comply.
digitale
Does
dans
it
les
mean
pays
that
du Sud,
in
après tout, il ne
countries
faudrait
of
pas
the
arriver au même
South,
cadre que la RGPD, un
they
cadre
do not
standard qui
respect,
existe, qui
they
est
do not
défini
have a
et
framework
qui peut
which
être
is
éventuellement sanctionné s'il n'est pas
enforceable and
respecté.
may come with
Ouais, pas que
sanctions.
dans les pays du Sud.
Well, you know, it's not only in countries of the South. We're talking about health data, personal data. Yes, we need a framework, and this framework also defines limits, thresholds, and is also a way for us to push the envelope and go beyond this framework. Currently, we're talking about many initiatives that are not defined within such
tout à l'heure, vous avez créé cette société après un long passage en ONG. Le constat que les ONG n'ont pas toutes les compétences, n'ont pas les moyens de se payer ces compétences en interne et n'auraient peut-être pas les moyens de les occuper à 100% non plus. Tout l'intérêt de les externaliser vers une société privée. Et là, ça semble coincé parce que les bailleurs, eux, ont du mal à comprendre cette manière de penser. Est-ce que vous pouvez développer?
Oui, tout à fait. Pour moi, l'une des solutions, c'est l'entrepreneuriat social et solidaire. Du coup, on a créé une entreprise sociale qui est à l'intermédiaire purement privé, qui a vocation à viser du profit, et du milieu associatif où justement on est tributaire des bailleurs, de la durée des programmes, etc. Pour pouvoir assurer de la pérennité, il faut avoir une structure qui va durer au-delà des programmes, pour pouvoir faire de la maintenance, pour pouvoir suivre, pour pouvoir faire de l'accompagnement, continuer la formation, etc. Par contre, effectivement, on est hors scope des bailleurs. En fait, on doit vivre
hors scope parce que vous êtes entreprise privée, donc suspect d'aller gagner de l'argent?
Non, c'est pas une question de suspicion, c'est juste qu'on rentre pas dans les cases. En fait, c'est trop nouveau, très nouveau. Du coup, on n'est pas une asso et on ne peut pas être éligible à tout un tas de subventions, d'appels à projets. Donc, il y a très peu de fondations qui arrivent à financer ça. Et les bailleurs classiques ne connaissent pas assez bien en fait, ce secteur-là qui mériterait vraiment à se développer. Parce que du coup, il y a des règles justement qui sont appliquées dans l'économie sociale et solidaire, notamment le plafonnement des salaires, etc. Ce qui veut dire qu'après, la question du genre, il y a plein de sujets hyper intéressants et qui font aussi qu'on a une capacité d'attraction sur des talents qui sont en quête de sens extrêmement élevés.
Donc, ça veut dire que les bailleurs, quelque part, ils se tirent une balle dans le pied en continuant à financer des projets comme il y a 10 ans, 15 ans ou 20 ans, alors que vous expliquez qu'aujourd'hui, il faut une technicité qui est nécessaire et qu'on ne trouvera pas dans les ONG.
On arrive à la trouver, mais c'est compliqué de les garder. Nonetheless, we find the talents, but it's difficult to retain them. C'est complexe d'arriver à garder ces profils-là, sachant qu'il en faudrait pas un, mais potentiellement 20.
And we need, not only one, sometimes we need maybe 20. on security, on development, on a number of topics, new topics, cutting-edge jobs, new jobs for some that are very new.
Je voudrais qu'on se tourne vers quelqu'un justement qui est un peu dans la même philosophie que vous, qui est au Bangladesh, à Dakar. On va aller rejoindre Mridul Chowdhury, donc je rappelle directeur de mPower Social Enterprises, qui gère entre autres Trauma-Link au Bangladesh, dont on a parlé ce matin. Mridul, est-ce que vous partagez le constat de Sébastien? Tout d'abord, il y a une technicité aujourd'hui que des ONG ne peuvent pas se permettre, et paradoxalement, il y a une difficulté pour des entreprises vis-à-vis des bailleurs à qui elles peuvent pourtant apporter cette technicité.
I'm sorry, I actually couldn't hear Sébastien very well through the audio system. So I'm actually a little blinded there.
Pas de souci. Je reprends les propos de Sébastien. Je pense qu'ils vont se rapprocher des vôtres aussi, qui nous dit aujourd'hui, les projets digitaux nécessitent de plus en plus de technicité, de compétences techniques. Les ONG, pour la plupart d'entre elles, n'ont pas les moyens d'avoir ces compétences techniques en interne. D'où l'intérêt de faire appel à des entreprises privées. Mais ce statut d'entreprise privée aujourd'hui est compliqué vis-à-vis des bailleurs. Est-ce que c'est votre sentiment?
Do you have the same issue in your country?
Yes, certainly. I mean, in my country, there are certainly restrictions regarding, grant funding coming to private companies. So grant funding generally has to come through NGOs. So getting private sector involved is not a very easy process, generally in development sectors, in development programs, unless there is a procurement process, and it's a cumbersome bureaucratic process.
Quelles sont les manières justement de contourner ce verrou, à votre avis, et d'arriver à une meilleure collaboration? Parce que si je comprends bien, on sera obligé de passer par ce passage.
You will need those skill sets eventually.
Right. So what happens, in Bangladesh at least, what we have done so far in a number of cases is that we have actually partnered up with NGOs. So when NGOs often think of getting the private sector involved as an afterthought. After they get a project funding from a donor, then they think about which private sector to get involved. Instead of that, what has often happened in Bangladesh, and then also with us, because I represented a private company, a digital health company, and we work very closely with the government and with several NGOs in Bangladesh and abroad. So what has happened often is that the NGOs, when they're writing the grant proposal to the donor, they essentially partner up with us. And then they write a joint proposal that, this is what we are planning to do, and this is how we want to execute things. So there are two advantages to that. Like the advantage, the problem that you were just talking about before, that NGOs often do not have the expertise in-house to be even coming up with a proper project proposal for a donor. And hiring a private company when you're writing a proposal or writing out an idea is often not sustainable. It's not financially feasible. So partnering up with a private company in a very early stage actually solves that problem. From both ends, from the donor end and also the NGO end.
Vous nous dites, et on voit bien depuis le début de cette table ronde, la clé d'un succès pérenne, c'est la capacité à avancer, on va dire, en crabe, peut-être, de la part d'une ONG et d'un gouvernement. On avance en le faisant. Et vous avez le même constat avec Trauma-Link que vous avez développé. Vous dites tout dépend de la maturité numérique ou digitale du gouvernement que l'on a en face de nous. Et il y a des grades dans cette maturité. Est-ce que vous pourriez nous expliquer justement
Could you tell us the different levels you are faced with?
Mm-hmm. So, we work with a number of different countries in Asia and Africa. And what we have often seen, over the last 15 years or so for the digital work that we've done, digital health work, is that, broadly speaking, countries are generally in three different levels of development in digital health. In the first phase, countries are generally just doing pilots here and there. Often they're not following standards. Often they're just deploying solutions just to test something out. Often they're small level pilots. So that's what happens in the initial stage. And I don't necessarily look at that as being absolutely bad, because I mean that's the learning phase, when you're making mistakes, when you're learning what's wrong and what's working and what's not working. But that's a phase that often countries just have to go through, and how long they will go through depends on policies and so on. In phase 2, I mean, government starts building their capacity when they have built some of their capacity in-house, so that they don't have external dependence as much as in phase 1. In phase 3, government starts taking leadership of digital health projects. I mean, they start developing projects, they start defining what they want to do and the kind of impact they want to have. So I think from a donor perspective, it's very important to identify early on which phase a country is actually in. Because if a country is in phase 1, expecting a phase 1 country to build internal capacity and internal sustainability overnight will not be feasible. So the expectations of sustainability, I think, will have to be customized for phase 1 countries. And the expectations can be more around, making sure that the right lessons are learned. And also, I mean, the other thing that happens often is that when you're making projects, I mean, there is just not enough resource allocation kept for building capacity within the government. I mean, too much money is spent on actually implementing the project, and not enough on building capacity within the government. So I think that's often a kind of oversight that I see in a lot of these development projects.
Mridul, alors qu'on découvre en même temps les images de Togo-Mali que vous avez développées, dont on a parlé ce matin au Bangladesh, quels sont les facteurs internes ou externes qui font qu'un gouvernement va passer ou qu'un pays va passer du stade 1 au stade 2, puis du stade 2 au stade 3 ?
I think internal factors would definitely be, governments' willingness, I mean, political willingness. I think that plays a big part, because some governments, like in the case of Bangladesh, a digitalization of all sectors was a political mandate. So digital health became a very big mandate to begin with. So I think that's one. So that's a big incentive for a government to move from one phase to another. The other incentive is when governments clearly see that digitalization actually leads to visible impact, and it leads to voter confidence, it leads to citizen confidence in government policies. Because digitalization, I mean, if you look at it from the point of view of a beneficiary or of a citizen, does not necessarily mean better services. Because often what happens is that a lot of the digitalization is about automating workflows. Like, you're automating forms, you're digitally creating reports, but that does not really bring benefits to the government, I mean, to the citizens directly. So the citizens don't really see a real impact. So I think the other thing that needs to happen, I mean, when you're trying to push a country to adopt digital health, is to make sure that from the very start, that projects are defined in such a way so that impact of digitalization can actually be felt by the beneficiaries in terms of, greater coverage, in terms of, a government worker's ability to reach somebody on time and in a timely manner. So all of these things that go with actually utilizing the data to bring about more efficient services. So I think that has to be taken as a big priority, because often I've seen in a lot of digital health projects that it's mostly about collection of data, as if collection of data and automated generation of reports is the end by itself. And if that is the end by itself, beneficiaries don't see any benefit. And they don't really buy into it. And then eventually governments also don't buy into it. So I think when you're designing projects, I mean, citizen benefit and citizen engagement has to be a big priority when designing projects, because that is what really keeps the government incentives going from one phase to another.
Mridul, il nous reste 2 toutes petites minutes avant la fin de cette table ronde. Effectivement, vous parlez de métiers et de fonctions de plus en plus précises, la collecte de data, l'analyse des data, la montée en compétences des uns et des autres. Il y a une question qui est centrale et peut-être aujourd'hui...
Sorry, I'm not hearing any interpretation.
Can you hear me now? Yeah,
alors,
now we are. We're
ça bascule voilà, sur le bon canal. Vous nous parlez de fonctions et de besoins de plus en plus précis, collecte de data, l'analyse de data, l'hébergement de data, et tout ce que vous avez d'ailleurs mis en place sur Trauma-Link, géolocalisation ou autre. Il y a une question qui reste centrale et qu'on ne se posait peut-être pas il y a 15 ans, 20 ans dans ce monde, c'est celui de la formation,
training, training to have new skills, and how can you maintain these skills in the digital services or NGOs, because you know that these people could leave and get better salaries in private companies. Do you have ways of training people and keeping people in your companies?
Yes. So are you mentioning about retaining talent within a private company, or are you talking about training people in the government or NGOs?
Je disais former et garder les gens dans votre entreprise où vous n'avez pas forcément les salaires des grandes entreprises à côté.
Sometimes they might want to leave to other companies where they're going to get better paid.
Of course, yeah. Yes, I mean that is actually always a kind of a holy grail problem when you're dealing with a digital company of any sort, because technologies tend to change and people will want to change. I mean, in the digital sector, it's just so that, I mean, except for countries like Japan and South Korea where people have lifelong employments, in most countries that's not the case. I mean, people tend to switch jobs. So and then we have faced that. And one way we have tried to prevent it is always making sure that we are moving up the value chain in terms of technology. What that means is that technology is always, newer technology is always coming. Like for instance, when we started out digital health 10 years ago, 15 years ago, the kinds of technologies that people were mostly getting trained in was about, collection of data, mobile applications to collect data. Then came different kinds of visualization tools such as DHIS2, where you can visualize that collected data in a very interesting manner. Now this entire industry is moving more and more into artificial intelligence. Like, how do you deal with a lot of data, analyze a lot of data, and come up with machine learning based assessments and algorithms. So for a private company to retain people, I think it's very, very important to kind of keep going up that value chain, because if it's stuck in the 10-year-old, 5-year-old technology space or the solution space, they will not be able to retain talent, because new talents will essentially want to go into the new technologies that are coming up and the new fields that are coming up. So for companies that want to retain talent, I think that kind of progressive mindset and looking into the future and preparing its employees for that future is of crucial importance.
Merci Mridul de ces explications.
Thank you very much, Mridul. I would like to ask the same question to Sébastien, because you have recruited, you're still recruiting people in IT for life, and this is something which was not an issue for you 10 years ago, where you didn't have such a digitalized environment. People were always there, they would stay, would be very stable. You didn't have to retain talents. People would get trained to stay in an NGO. But now with digitalization, things have really changed, and the issue of training is really, I think, basic and crucial.
Du coup, ça, on en parlait aussi ce matin, et on en a parlé cette semaine avec la Fondation Pierre Fabre, et là, j'ai pu en parler aussi avec l'AUF. Je pense que oui, c'est essentiel de former des gens, localement, et sur ces technologies-là qui sont rares, donc sur des chaises de comment qu'est-ce que c'est que de la collecte de données, comment on fait une analyse, comment on répond à un cahier des charges, comment on construit un cahier des charges. Donc c'est au-delà des compétences techniques, c'est ce qu'on disait au début, c'est tout ce qui est autour. Et du coup aussi, faire des stages, faire de
environment we have for digitalization. We also have to have people who can change positions in the same company so as to make sure that they understand what is at stake. And therefore, as Florent said this morning, we're not going to be able to connect people. If you don't have connectivity, well, you can't do anything. So you need connectivity. You need people, experts who can train other people, and where you're sure that you're going to be able to master the tools you have. And we know that the people we're going to train are always going to find a job elsewhere. So this means that we have to be very inclusive. We have to take into account gender issues. We have to take into account the awareness concerning these tools. Aristide, Afèignindou, Gnassingbe, I would like to ask you the same question. That is to say, how can you retain talents? That was not a problem 15 years ago. Is this something you really keep in mind today? Well, thank you for this question. Yes, yes, I'm happy to take the floor again. I was very interested by what was said, and especially by our friend in the United States, when he said that you have to make sure that you can speak to policy decision makers, but they don't have to understand everything. I think that you have to make them understand how important it is for us to digitalize and to have e-health. When we started digitalization, is because something wasn't working, and we needed digitalization. You don't need digitalization if everything works well. You can exclude digitalization and find solutions, but we know we can't do that anymore. So we have to explain to the decision-making people that we need digitalization, even though we're not going to go into the technical details and try to explain everything to them. Now, when it comes to recruiting and retaining young talents, well, in Togo, when we started digitalizing and when we had telemedicine developing, we had internet connections. And today, this is not the case anymore because Togo is one of the first countries which has fiber optic.
N'est plus d'actualité. Maintenant, comment motiver les uns et les autres? On ne va pas former des médecins pour devenir tous des informaticiens, tout ça, là où former des informaticiens pour devenir des médecins. C'est l'approche beaucoup plus intersectorielle qu'il faut promouvoir. Cette question de la santé numérique est une question transversale. On ne peut pas la gérer seul. Vous avez besoin d'un autre, l'autre a besoin également de vous. Aujourd'hui, ce qui se passe sur le terrain, c'est de l'amalgame. C'est pourquoi il faut mettre les moyens au-delà du développement des compétences en technicité. Il faut également former aussi des praticiens parce qu'à la fin, l'outil ou la technologie ne va pas remplacer l'humain. Et tenir compte aussi des besoins des populations à la base. La population à la base, elle est bénéficiaire. Donc, il faut tenir compte d'abord de leurs priorités. Donc voilà un peu ce que moi je pense. Retenir quelqu'un, si la personne qui est en train de travailler se sent à l'aise dans un domaine défini, et s'il a ce qu'il faut pour mener à bien son travail, il va y rester. Mais généralement, qu'est-ce qui se passe? Pourquoi les hommes partent? Parce qu'ils trouvent mieux ailleurs, et c'est la question financière. Donc vous voyez un peu qu'il y a trois niveaux. D'abord les ressources humaines, les ressources financières, et puis les ressources matérielles. Aujourd'hui, on parle de la télémédecine. Il y a la technologie, il faut que les États soient en mesure d'acheter aussi les outils nécessaires. Et chaque jour, il y a des mises à niveau, tout ça là, ça évolue. À chaque fois, il faut insister sur la formation aussi continue. Donc voilà un peu ce que moi je dirais. Si les hommes partent, ils partent parce qu'ils trouvent mieux, ou soit ils sont sous-utilisés, ou soit ils trouvent mieux que leurs compétences peuvent être mieux valorisées ailleurs.
Merci de ces explications. Il nous reste quelques minutes cette fin de table ronde. Beaucoup de choses qui ont été dites depuis le départ. Cette question de la pérennité, côté technique, on voit bien sur les projets aujourd'hui en santé digitale. Je vous propose de prendre la parole. On va faire circuler un micro dans cette salle pour tous ceux qui veulent poser des questions. Et on partira également tout à l'heure sur un autre campus de l'AUF. Voilà. Monsieur, on vous apporte le micro rapidement. Je vous demanderai de vous présenter, puis des questions courtes à chaque fois, comme ça on aura pas mal de réponses pour les intervenants ici ou pour nos intervenants qui sont à distance.
Merci beaucoup. Je suis Rodrigue Akoli, fondateur de la plateforme e-santé conviviale. Je viens du Togo. Et je voudrais m'intéresser à l'intervention de Sébastien par rapport à l'obstacle qu'il a eu pour en tant qu'entreprise. Effectivement, quand je prends notre situation au Togo, nous avons eu la même difficulté en tant qu'ONG. En tant qu'ONG, nous étions confrontés à un obstacle par rapport à la mobilisation de ressources. Donc, ce qui nous a amené progressivement dans notre plan d'action, dans notre plan stratégique, à passer de l'étape d'ONG en entreprise. Et grâce à une formation que nous avions obtenue auprès du gouvernement, nous avons pu créer une entreprise qui intervient dans le même domaine et qui d'ailleurs arrive à mobiliser les fonds et à appuyer l'ONG. Donc, je pense que c'est également une opportunité de réfléchir dans quelles conditions on peut également pour freiner ou bien lever cet obstacle et que vous avez parfois auprès des bailleurs passer à l'étape sociale également.
Sébastien,
Sebastian, maybe you would like to react to what has just been said. Yes, this is what we're going. We're not going to do that. We're going to create an association so as to collect funds. We come from an NGO. We were 100% NGOs, and we had a conflict of interest, and therefore it didn't work too well. And this is why we wanted to create an association so as to be able to have the possibility of developing our activity. And this is why with our donors, we had this discussion. They told us, no, you have to have two separate entities, and this is why we're going to create an association. But as I said, we have a difficulty here for the sustainability because we're going to be creating this association. We're going to say we're wonderful, we're doing very well, but we know that it's not going to be the case in a sustainable manner. We can't just stay in the marketing.
Je poursuis la réflexion de monsieur en matière de formation de talents,
when we speak of training talents, retaining talents, especially for digital skills, what is your situation? Do you think that the fact that you're being a company, it's going to be better when you want to attract young talents? Because probably they believe it's more interesting to be in a company than in an NGO. You see, or in a company incubator with digitalization, young people feel better. It's more attractive. Answer: yes, I think that we have to do is become a social company, because then we have different talents, and the difficulty is the scale of our structure, because our structure is small and limited. And we're very dependent upon the people. We have very, very good talents in the company, people who are very good in technologies and who have been awarded by our foundation. But with all these exceptional talents, we also attract other people who are going to try to take them away. So we have to have more positions so as to make sure that we're not going to be in a difficulty when we lose some people in the company. Other questions?
Toutes vos questions sur cette thématique, comme ça, elles nous arrivent en direct et on peut les donner en direct.
Je voudrais juste vous remercier parce que j'ai trouvé ça absolument extraordinaire, cette session. Donc, vraiment merci aux intervenants. En fait, moi, je voudrais juste dire, est-ce qu'on peut faire un plea to action? Comment est-ce qu'on dirait en français? Un appel à action. Parce que je disais ce matin, je reviens sur les routes ou le tronc de l'arbre. C'est-à-dire, je disais ce matin, il y a 12 pays seulement qui ont implémenté des stratégies. Donc, on a parlé tout à l'heure de ce besoin de formation au sein des gouvernements aussi. Vous parlez de différentes problématiques de formation. On sait qu'il y a 3 programmes aujourd'hui. Il y a Derek qui est là. Il y a un programme en MSIT de formation. On a la Fondation Pierre Fabre avec COB. Je ne vois pas où est COB.
Il est dans la salle. Voilà.
Il m'a dit
Cheikh Oumar Bagayoko, COP pour les intimes.
60 candidats COP, je crois. Et pas forcément que des gens du gouvernement, j'imagine, dans la prochaine session. Et puis on a un autre qui s'appelle le DALP, le Digital. C'est comment ça dit, Derek, qui est l'appel d'offres qui a été lancé, c'est avec l'Université du Rwanda, je crois. Digital Leadership. DLAP, right? Applied Digital
applied digital, I think.
Donc, on a 3 programmes de formation, mais qui accueillent qu'un nombre limité finalement de candidats. Donc voilà, il y a certaines personnes dans la salle, je pense que soit on peut essayer d'imaginer de passer à l'échelle, mais moi, en ce qui me concerne, je trouve qu'il y a urgence parce que je vois cette effervescence. J'ai évoqué ce matin, il y a des startups, il y a les investissements privés, parce que je n'ai pas tout dit ce matin, mais je sens que c'est prêt à décoller vraiment beaucoup. Et tant qu'on n'a pas ces routes en place, ça ne va pas. Donc, si le frein essentiel, et c'est ce que moi j'ai pu observer dans certains pays, c'est la formation de personnes au sein du gouvernement pour maîtriser ce sujet assez pour pouvoir développer ces routes. Voilà, c'est un appel à l'action.
En tout cas, on voit que c'est une carte, la notion d'information, de sensibilisation et de formation est une carte centrale. On va amener un micro. Voilà.
Merci beaucoup. Thank you very much. I couldn't resist myself after the point that Florence mentioned. So I wanted to give a quick intervention, complementing what has been mentioned and what others have mentioned. The issue at hand is how do we ensure that the transformation of the health sector leaves no one behind when it comes to the capabilities of the individuals, the people that exist in that ecosystem. Florence and other speakers have highlighted an important point because for 15 years, we have seen the industrial revolution going forward, but the people skills and the structures in which the people live haven't gone addressed. We still have old job descriptions. When you go in governments, you still see titles, systems analysts, okay, IT manager used previously. And in health, you still have the challenge because governments have not changed the job descriptions to include e-health and digital health skills. So the question of competencies to inform revision of job descriptions becomes important so that people are employed appropriately, they are interviewed correctly, and the job market changes consistent with the changes in the ecosystem. So it's an important area for all of us, developing partners, to address so that we're in touch with the changes in the environment. Merci beaucoup.
Merci. Sébastien, est-ce que vous voulez compléter effectivement?
Sebastian, would you like to pick up on this because it's really interesting to see that after the roundtable training, which was not the main topic, is really becoming is really at the heart of our concern. Yes, I think that what you just said concerning explanations, information, rolling out training for NGOs, and explaining what we're expecting from all these skills is really important because if you want to recruit someone who is good in IT, it doesn't mean anything anymore. You have to be more specific. You have to make sure you know what kind of profile you're talking about. And therefore, I think that what are the jobs we need today, what are the skills we need, and it has to be well understood by everybody.
Je vous propose, Sébastien, d'aller à la rencontre d'autres personnes qui vous écoutent attentivement depuis le début de cette table ronde. On va se rapprocher d'un endroit qui vous tient cher à cœur, qui est la plage du Virage à Dakar, où on va se rendre sur le campus de l'AUF, qui nous écoute depuis le début de cette session et qui a très certainement des remarques ou des questions à poser à l'issue de cette session. Qui est-ce qui est là à Dakar?
Alors merci à Dakar,
Michel.
Je suis toujours en compagnie doyen honoraire de la faculté de médecine.
Here I am with some of the colleagues of my faculty. The sound is very bad, says the interpreter. We're sorry, we're doing our very best. So I don't know, after what you've said, and very challenging discussion, we will be able to ask my colleagues here around the table if they have anything special to say, because I'm here with my colleagues here. I don't know, maybe they have comments. Thank you. Thank you very much, Michel.
Je pense que ça a été dit et je pense que ça c'est la chose la plus importante.
I think that what we've said today is very essential. That is to say, training. Training is the really the essential concept we've been dwelling on. And this is important for the e-health sector. Of course, you need IT experts, and we need people who are skilled enough, and this is why we have to train them, of course, not only in the field of IT. This is what we've tried to do in Senegal, in Dakar. We have been trying to set up some training modules for that, and it's something we're very much aware of the importance of these new skills for the development of the e-health. So, as I said before, this is really the main effort we have been making. We have many tensions on the market, and we have to train people, as I said before, taking into account this cross-sectionality and this complementarity you've been talking about. Make sure that these people who are going to be trained are going to be able to work one another. Sébastien, we have the possibility.
Allez, très rapidement, Michel, effectivement.
The sound is very bad. I'm very sorry, says the interpreter. There's an echo in the room. I'm working in the veterinary school, and I would like to speak of e-health for humans, but also should we take into account animals, because the animal health is also very important. And this is something which is also one of our concerns.
Merci beaucoup de ces interventions depuis Dakar. Je sais que vous suivez cette journée avec beaucoup d'attention. Merci, puis on vous retrouvera d'ici la fin de la journée. Merci également à nos intervenants qu'on peut applaudir sur cette table ronde.
And I would like to thank our panelists. Thank you very much.